I went to undergraduate at South Alabama there across the bay. After graduating there, I went to the UAB School of Optometry up in Birmingham. And to complete my training, I went to Northeastern State University to do my residency in family practice optometry, where we worked alongside the Cherokee Nation to see a bunch of patients out there. What brought me here was when I was in training, I was constantly asked, where do you want to end up when it's all said and done? Of course, I'd gone to South Alabama, so I really knew that the area around here was somewhere I'd really like to be. And folks had a boat down in Gulf Shores. They were coming down. My dad broke his glasses, so they stopped at the practice over in Foley. And my mother, being my mother, of course, she has a bunch of cards on her. And she hands it over to the office manager over there while I'm still in residency. And she said, well, if you're looking for an optometrist, my son happens to be finishing his training here soon. So if you're looking for an optometrist, he's going to be available soon. So they were looking, and I got the call, came down here, did my interview. They hired me. Haven't looked back since then. I'm really enjoying making people's vision better. I mean, it's so cool to have somebody come in who can't see, the world's kind of closed in on them, everything's dark, they don't realize how much the trouble they're having. And we're able to do something maybe as simple as fitting them with a pair of glasses or contact lenses, or something more complex like maybe doing cataract surgery on them. And when we get that vision back, where somebody can see again when they haven't been able to see for a while, it's just so heartening to see somebody be able to do things they haven't been able to do for years. It really keeps you feeling good about yourself and about what you do. To me, the most critical part of an eye exam is really getting the history of what's going on here. I like talking to patients. I like listening to what's going on, what the problem is. Because I've found over the years that patients don't always know exactly what's going wrong with their eyes. They usually got a pretty good idea. And if I just listen to them, they usually set me on the right track for figuring out what's wrong and what I can do to fix it. I think really the best way to maintain your eyesight is, of course, getting regular checkups there, because you can really find problems and fix them before they have a chance to really cause long-term issues. Of course, all the normal stuff you hear about eating right and exercises is valid here too, because we tend to find healthy eyes inside of healthy bodies. What I think makes Southern Eye Group different from most optometrists is the fact that we work with so many different types of specialists. We work with cataract surgeons, we work with glaucoma specialists, we work with retinal specialists. So not only are we able to really handle your normal type of eye exam needs like glasses or contact lenses, we're also able to find and recognize other problems with the eye and appropriately move those patients to the right people to get them better.